So I just got back from lunch with a friend of mine who works in the healthcare supplemental Medicare industry. And we did a lot of talking, and we did a lot of talking about patient empowerment and patient advocacy. And I want to talk to you a little bit about today about getting your bills paid, because this is a big issue for a lot of people. When my son was sick in 2016, he had Blue Cross Blue Shield. And I was concerned, obviously, about the hospital bills after he'd been in the ICU for 24 days and was in the hospital for almost 50 days. And we actually were able to get him some supplemental Medicaid coverage to his Blue Cross Blue Shield because he had not had any income in 2016 because he got sick early on in the year. So this was a great benefit to him, in addition to his private, personal Blue Cross Blue Shield in North Carolina that he had. And it was not based on assets that he had. It was strictly based on him not being able to work because of his illness. And that was a great thing. So I would suggest, if you find your loved one or yourself in the same situation where you have assets but you don't have any income, that you should talk to the billing office or the financial office at the hospital or the healthcare facility where you're at to see if they also could apply for some Medicaid supplement for you. The other thing I want to talk to you about, and I may have spoken to you about this before, is when we were admitted to Lenox Hill Hospital in March of 2016, I made sure that the hospital took Jordan's insurance, and every doctor that was called in, I said to them, "Do you take Blue Cross Blue Shield?" And they all said, if we affiliate and we work at Lenox Hill Hospital, yes, we take whatever insurance the hospital takes. But the one thing I want you to be aware of is that doctors really don't even know all the different healthcare plans that their office accepts, because that's part of their billing department, and they have office managers for that. So I have a lot of doctor friends, and I'll ask them, do you take Aetna? Do you take United? Do you take Blue Cross Blue Shield? And they'll tell me, I'm really not sure. You have to speak to the office manager. So I want to make sure that you realize that a doctor is not necessarily going to say to you, what's your insurance plan? I accept it or I don't accept it. Okay, that's your responsibility as a healthcare consumer. Once you assume the role of patient somewhere, you need to ask them, do you take my health insurance? Then you have a choice whether you want to continue to use that doctor or not. In Jordan's case, we had two scenarios where his healthcare team that accepted Blue Cross Blue Shield called in a referring physician. One was a on-call surgeon, general surgeon, who did a lymph node biopsy. And we didn't contract with the surgeon, but the healthcare team did, Jordan's lead doctor. And it turns out the doctor is at a network for Blue Cross Blue Shield, which means that Blue Cross Blue Shield will pay them, but at a lower rate, and they won't pay him until Jordan is met out of network deductibles, which Jordan hadn't met at all because all of the doctors that he had been using were in network. So that started an 18-month saga of me dealing with the surgeon and dealing with Blue Cross Blue Shield. And my premise was that as a family, as a patient family, we did not contract with the surgeon. The healthcare team did. So it was out of our control who they called in. And secondly, it was part of an emergency room admission, which really fell under an emergency diagnostic procedure. And I stood firm with those two premises. And it went back and forth literally for 18 months. And every time I spoke to somebody or I sent a note to Blue Cross Blue Shield, I made sure that I communicated with the surgeon's billing manager so she knew what was going on. She knew that I was working on getting the doctor's bill paid, and she knew not to send Jordan to a collection agency. So for 18 months I documented, and then we appealed the decision because they refused our request to pay the surgeon in network. And I continued on. I persisted. I got a phone call from somebody from Blue Cross Blue Shield on one day saying the case had been closed. The same day I got a letter in the mail from them dated a week prior that they would give us a decision in 30 days. So I was persistent. I sent packages of documentation, and ultimately I refused to give up, and I got them to agree to pay this surgeon at an in-network. And the surgeon's billing manager had told me all along that they would take an in-network payment. So the surgeon's bill was in excess of $7,200. And during the course of those 18 months, I said to the surgeon's billing manager, if Jordan has to pay out of pocket, will you negotiate down the price? And she said, of course, but let's see what happens. And so that $7,200 bill was reimbursed at $3,200 as an in-network provider from Blue Cross Blue Shield, and the doctor was satisfied with that, and that was the end of that crisis issue. The other one was the medical team, like during the first week of ICU hospitalization, called in a dermatologist because Jordan had a very bad skin rash, and the dermatologist took multiple skin biopsies. And also, we got a bill from him for $650, and lo and behold, he's also out of network. So I called the billing manager to talk about negotiating down the price, and basically she said to me, Mrs. Clemens, you and your family have a lot on your plate, so we're just going to write off this bill. So don't worry about it. And I said to her, thank you so much, and at the expense of being very brazen, I said, would you please send us an invoice showing that there's a zero balance on the account, so if you leave work or you get sick, that everybody will know that Jordan has a zero balance. And she agreed to do that. So never give up the fight. Never ask the questions. Never be afraid to ask for a negotiation of the bill. If you feel that you're right, don't stop pushing until the fat lady sings. And medical bills, you've heard me say this before, they don't go away by ignoring them. What happens when you ignore them is they send them to collection agencies, and then you get bad credit. And while they won't take your house and they probably won't sue you, if you go apply for credit, you won't get it. And also, if you sell your house, they could put a lien on your house, which means in North Carolina, a mechanic's lien means that they have first dibs at the money you owe them when you sell your house. So don't ignore the bill. When I finished dealing with the surgeon, his office manager, her name was Tatiana, said to me, Mrs. Clemens, I've never met a person, a family member, who wanted to pay their bills so badly. And yes, I wanted the doctor to get paid, but I didn't want to be ripped off in the process. So that's my story to you for today. Never give up when it comes to bills. If I'm really good at this, if you need me to write a letter, if you need me to make a phone call for you, contact me at PatientAction.com. And fee for service, but I'm happy to help you out. And that's what my passion is. That's what my mission is. That's what my business is. And have a great holiday season. Thank you for stopping by and watching me today. I'm always teaching, preaching, and living patient empowerment, and make this an empowered day.